room at the front row, so feel free to move forward, ask your questions.
So thanks for staying, guys. We realize we're standing between you and cocktails, so this won't be boring, I assure you, but there'll be lots of numbers on the slides over here that we're going to sort of refer to as we talk about this. But before we get started, a little bit about the data itself, right? It's been alluded to in the panel before. How do you capture the data? What is the data that you have that enables us to get this wonderful slides that we're going to put together today to talk about?
Okay, thanks very much, and thanks to everyone for being here this evening. I'm going to have to gallop, as I just realized we also lost 5 minutes of our time, so we're going to have to go very fast.
Very fast.
So very quickly, Julien de Salaberry, CEO and founder of Galen Growth. Galen Growth is a global leading digital health data intel insights provider to industry and to investors. It is a task that we've been following for the last 8 years by specializing uniquely in digital health and looking at all of the digital health ventures across the globe and looking at the digital health ecosystem through that lens in terms of what activities and achievements they've been building over the last few years. And I was really trying to solve one pain point, which is when I was at Merck & Co. doing that exact work with GHI or alongside GHI, I could not get the data I needed to do half-decent due diligence and therefore screening in or screening out digital health ventures. So that's the data, 680 million data points that we leverage for analyses such as this.
There are a number of these guys out there, right? You know, we see these reports from Rock Health and Startup Health and CB Insights. What's the difference here?
Well, I mean, every one of them has their merit, but we, by specializing in digital health, are able to get a much greater breadth and a much greater depth as relates to digital health, which is why our clients come to us and see us as number one choice to be able to navigate digital health in an informed manner. And some of the data points we capture are unique, such as getting into really the clinical evidence. And so one of the things I did not hear mentioned particularly loudly in the previous panel is proof points. I mean, path to profitability is important, but proof points as well. And clinical evidence is an important one, for example. So those are sort of things that we measure.
Great. So I know we've taken a cut for here, for Europe. Should we hit the slide button and see what's coming up next as far as the data is concerned? Shall I do this?
Yeah, we can do it. I just want to do a quick bit of context. So this analysis is really kind of piggybacking on the analysis that was presented last year virtually, I think, by my colleague and CRO of Galen Growth, Dara Heyman. And last year we looked at, I think, the top 50 digital health investors across the globe, irrespective of what sort of stage you're investing, etc. This year we decided to continue the relationship with Health Tech Forward, but retool the analysis slightly and focus on two important filters. One is looking at early stage investments only. So we've ignored all the growth and late stage. But more importantly, we wanted to focus on what I would describe as the core investors. And that is the set of investors that have invested during the period of 2019 to 2023. So pre, during, and after the pandemic. And therefore, really focusing on those that are dedicated to digital health as opposed to, I guess, fleeting in and fleeting out as a diversifying strategy. My eyes fail me in terms of reading this, but the couple of the data points you've got in front of you are important, which is if you look at that period 2019 to 2023 year to date, we're virtually at the end of 23 anyway.
Yeah, and this is early stage only, right? Early
stage only, yeah. We're looking at $163 billion US having been invested in that period of time across some 9,325 deals. We're looking at some 8,700 unique investors having invested in that period of time. So it's been busy, without doubt. But we are seeing what was described very aptly in the last panel, which is that dip, 21 being absolutely extraordinary year, complete outlier really, and a slow return to what I would describe as normality in 22 and 23. So none of that is new to everyone. Everyone
is it an adjustment?
Knows that.
Is it a market adjustment? Is it number of deals not being put forward? What do you think is the attribution?
So I think we're seeing a natural maturing of the ecosystem. We're moving out of hype. We're moving into reality, driven by geopolitical and eco reasons. Which are affecting all tech sectors, all investment sector, without doubt. So digital health is not unique in that situation. But what we are seeing, I think, is the system moving, or the ecosystem, the digital health moving from is what is a very much what I'd call a cottage industry. Many tens of thousands of digital health innovators out there, not all of them very differentiated from each other, attracting funding like no tomorrow based on a great story up until the end of 2021. And then that music stopped for various reasons that we're probably familiar with. But I think as a result, we're going to see consolidation. So we heard some of the high-profile failures that are coming out of the US. And I'm very much aligned to the general conclusion of the previous panel, which is 2024 will be 23 more of the same, and then some more pain, in my view. But we can come back to that.
But it seems like on the big charts, that was the exuberance around, I've got an idea, I'm going to get eyeballs, give me $1 million of seed and I'll get going. Now it seems to be more around what's the business model, what's the clinical piece of this. Is that what you're seeing from the data?
So we're seeing two things. Certainly focus on proof points. Reimbursements and how you can actually gain reimbursement. Proof point, clinical proof point, for example. Of course, how are you restructuring your business model to be more profitable, or to be profitable, full stop, in the first place. Bridging rounds, I heard a little bit about bridging rounds in a previous panel. Yes, we're seeing a lot of bridging rounds. We're seeing a lot of debt funding as well. And I would suggest that some of that is not just about reinvesting with follow-on. It's really around trying to keep away from the valuation story, because that's not a pretty story, and that continues to bottom out.
Interesting. All right, let's go to the next one. These are the indices that you guys used. Maybe you can tell us a little bit about how this data was put together.
Sure, I'll keep it as brief as I can, but we leveraged the data points that I talked about on our platform called Health Tech Alpha to define specific indices that are our independent third-party evaluation of a digital health venture. Now, we have a number of those. The 4 you've got in front of you are a sample of the 7 or 8 that we have built. But we decided for this analysis to look at, once we decided the period of time, we decided the funding stage the investors investing in, what did that leave us by way of investors? We then wanted to look at, okay, so those investees, so to speak, going forward, how were they different to the others? Because coming back to the point made by Dominic earlier on, the runway for a lot of these ventures is running out. It's what we call the funding strength to be positive, but it's really funding stress at the moment. But that's telling you, if you look at the bullet point at the bottom, the left-hand side, and then you look at the chart to the right, that if you look at those 4 indices, team signal, how good is a management team, roughly speaking about 50% of the investment decision at early stage, how good is their innovation versus the rest of the market.
The uniqueness of the product.
Yeah, because there's a lot of incremental out there. So we like to look at the difference of that. Partnership signal, of course, generally most digital health is B2B2C. Or B2B2P, and therefore you need that commercial partner, pharmaco or health system, etc., to scale. So we look at the quality of that, and of course we look at one of the signals there is evidence signal, clinical evidence. So what have you done to get a clinical trial there to back up your medical claims? What have you published? What patents you've got, etc. And so if you look at those 4 signals for the ventures that have received the funding in that period of time, invariably, looking at the chart to the right, you will see that they are generally, those investees have been outperforming the rest of the ecosystem on a like-for-like basis.
Based on those 4 signals?
Just looking at those 4 signals, ignoring some of the others we have, such as, for example, their funding strength.
Let's breeze through this, because I'm sure some of these guys have questions. So the next one is around, you talk about partnerships being important, and this chart seems to say that.
Yeah.
Did I read it right?
No, you're absolutely right. And we at Galen Growth were a little concerned at being at 23 with all the noises we could hear that partnerships would slow down, having had a major hiatus in 22. Now, on track to exceed, 23 is on track to exceed 22 in terms of partnerships. We look at that with a great deal of scrutiny, largely because we're very interested in understanding who's partnering with who, to solve what pain points, but more importantly, what does that mean in terms of the other indices, the other triggers such as funding, etc. So we look at that very closely. It's interesting to note that, for example, healthcare providers are growing in their share of partnerships. So health systems, for example, in the US are certainly prolific, and say similarly in the UK. I mean, a lot of you probably saw the pain point expressed by the NHS on about 2 weeks ago, 8 million people on the wait list. More recently, last week, a piece of analysis saying that some 45% of Brits are now self-diagnosing because they just cannot get access to an HCP. So health systems are very, very keen to understand how they improve capacity and productivity through digital health. Pharmacos, of course, are the others, worth watching there. And we are certainly seeing a continued progress in a number of pharmacos that are building partnerships. But we are seeing a massive shift away from things such as patient engagement that has an empty business case still, as pharmacos are concerned, and a huge double down on R&D and productivity of R&D, correct.
Clinical seems to get a lot of the investment on the
It
R&D
has,
side,
it has, certainly. I mean, obviously the pandemic triggered a lot of that. Now we're seeing even more emphasis on R&D, bioinformatics, AI, etc.
Okay. Exits. We talked about exits. Everybody was talking about exits. I asked him earlier, I said, all right, if I've exited 100 million, that's good enough, right? If I've raised 10.
It depends on which way around you look at it, but yes, correct. Listen, this slide is an extract from a piece of analysis that we presented at Frontiers Health in Rome a couple of weeks ago. For those of you who were there, I apologize for showing the slide again, but it's an important slide because one, it tells you that, of course, 21 continued being the hiatus, including for exits. But it also shows you that in 2023, we've seen a significant dip in exits. Of course, in Europe, no IPOs, no SPACs. But generally speaking, IPOs and SPACs are down to practically nothing, even in the US. So it's really M&A. But the important thing about that analysis, is if you look at M&A and you look at a simple measure, MOIC, so multiple on invested capital, and keeping it really simple, which is let's take the exit value, the M&A exit value, and then divide that by the total amount of invested capital in that venture during its lifetime. It's not that scary. And what I mean by that is that for those where you can calculate the MOIC, you will find that some third of those M&A exits, over $50 million in value of M&A exit, to be precise, have registered an MOIC in excess of 5x. Which for MOIC is not bad, yeah? But then it's a question of looking at what is actually exiting. Is it exiting because it's really attractive, or is it exiting because it's stressed and it needs to get out of its position? And
do you count the acquisition by a corporate or a merger with something as part of the exit, or is it just pure exits as far as IPO or whatever?
We tend to count all exits, obviously. Now, there's a fairly large chunk of exits that are M&A mergers between ventures, where they tend to be share exchanges as opposed to cash. So it's more the corporate type acquisitions that we look at from a specific actual exit value. So that's I guess you should have done the drum roll before that.
Sorry. Let's go back. Dun, dun, dun. Okay, the big reveal. Who are the people that are actually spending the money?
So what we wanted to just share with you is if you look at it globally, it's drowned out by the US guys. So we thought, okay, well, let's drill down to just looking at European. Who are those investors that have been investing during that period, 2019 to 2023, and have been doing so in a continuous way and a multiple way? Now, quick caveat, we excluded all grant generators. We just focus on venture capital deployment here. And so you'll see your usual, I guess best described as repeat offenders like BPI France, which you would argue is a government play. No matter what the weather is out there, they will continue investing, particularly if you look at their portfolio, it is largely into French ventures, as you would expect. But it was nice to be able to demonstrate some of the investors that are European-based, but also tend to be very much European-centric in terms of their investment play.
Dun, 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 the next slide, and the last one.
We inevitably wanted to show what the US looked like, so that you saw that we'd not ignored the obvious ones. A lot of the names out there will be very familiar for you. And so I don't think it's probably much point jumping into any specific names there, but so
it's interesting to see a PE firm at the bottom of that list, which is...
Tiber Global Management.
Yeah.
Yeah, I mean, listen, it's fair to say that they have had a spray and pray type strategy, which
Just
means
like General
that
Catalyst.
who are at the top of the list. But we'll see how that plays out down the road as we start looking to exit value and the other metrics that I mentioned this afternoon. But yes, at the moment, it's interesting to see how some of the players that have been very prolific and have been very much in the news are in that top 10 for the US. But that's why it was important for us to distinguish Europe from the US, to be able to show who some of the US, some of the European players there.
That was the last slide. Any sort of last guidance for the people in the room who are looking to either raise money or get some bridge loans or do whatever it is they want to do to get going here?
It's a real tough gig, and 2024 sadly is not going to be easier. But they say it's a game of two halves, and I think I would suggest certainly prepare to continue weathering the storm for the next 6 months, and hopefully we'll see ourselves be able to turn the corner in the second half of next year, where we'll see some better light, let's say. It's the same for all of us. Listen, we're only an 8-year-old business, and we've been profitable since the get-go, and we've never raised any funding. We're somewhat pleased that we haven't raised funding, but we're also acutely aware that large organisation continues to restructure, which means decision makers change, which means that discretionary spend gets frozen, etc. So it's the same pain point that we all experience. Yes, focus on making sure that you're not carrying excess baggage as much as you can. Focus on your proof points so you actually can back up every claim. And try and figure out how to generate cash as opposed to raise funding, because the VCs are having a hard time too. Their manufacturing machine is constipated. There's no IPOs, there's no exits, so therefore nothing moves from left to right. Their LPs are walking in different directions because they're getting returns elsewhere, or more attractive returns elsewhere. Who was it? What's that big PE firm that's had to fire its entire new fund team? It'll come back to me. Largely because they couldn't raise the funding they wanted.
Well, there's a good number of those out there, right? I mean, our friends at Vive got still sitting on 300 million of the 350.
Yeah.
So not going anywhere. Well, thank you for that. Thank you, everyone, for staying for this bit, because we know there's drinks out there. We'll open it up for any questions. The only thing I would say is a plug for Galen Growth. Follow them on LinkedIn, because they do a daily posting of partnerships that have been announced, which is really interesting to see. You can see a trend forming as you go through that.
Yeah, the one thing I would add as well is, and in respect for, of course, the opportunity given to present this snapshot of the data, is, of course, the Health Tech Forward team should be forwarding a link or making available a link via the app for the fuller report. So not just the 4 or 5 slides, but I think it's 15, 20 slides of analysis. So keep an eye out for that and download it free of charge.
Which would have been one of the first questions, I'm sure, if you didn't explain it right now.
There you go.
Ladies and gentlemen, I certainly encourage you to ask both Julien and Ritesh questions during our networking events later. But now, time for a quick symbolic question. We have less than a minute left. Anyone? Closing question of the first day of Health Tech Forward. No.
Julian, you explained it so well. Look at that.
They're all thirsty.
Amazing. They're all
Question
thirsty.
from me, where are the drinks?
Well, they will be difficult to miss. Thank you very much, gentlemen.
Thank you.
Ritesh, excellent presentation.
Pleasure. Thank you.
Thank you so much.